Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
and Amari Richards. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz. Hey everyone, welcome to the November episode of Health Equity Mondays. You are joined by Jasmine and Omari, and today we are going to discuss infant mortality rising for the first time in 2 decades, and the wellness industry is now worth $5.6 trillion. Woof, that's a big number.
That is a big number with a T.
With a T. So how are you doing, Omari?
I am tired. I am also exhausted, but feeling good. As I was telling a friend the other day, because I just got done with a conference, the Philanthropy Southeast conference in Montgomery, Alabama. I was able to go to the Legacy Museum. I was able to go to the National Peace and Justice Memorial Center, the Rosa Parks Museum, the Freedom Riders Museum. So just a lot of introspection and learning and understanding of what happened in Montgomery, Alabama. I didn't realize just how prominent enslaved people were there. And one of the things that really stood out to me was like between 1820 to 1860, it started off at 40,000 enslaved people in Montgomery, and then it was 400,000. So 10 times the amount of enslaved people were in Montgomery, Alabama. And it's fascinating because when you go into the museums, you kind of just learn about the history of the place and just how everything, the entire downtown was built around enslaved people and like capitalism around that, like cotton gins, etc., etc. And what's also fascinating is that a lot of the signage of where the enslaved people used to come into the city was not, they didn't speak about that or speak about like enslaved people, which was fascinating in of itself. And one thing that really stood out to me that I literally didn't realize was just how prominent lynching was. And that just really hit me. So like, just to say all of that, it has been tiring, draining, as well as like inspiring, motivating, and like just wanting to continue to do work to move things forward. But yeah, some of the stories that we read about, like it'd be like children that were in jail, and then white mobs would come in and steal them, and then do all these kinds of things, lynching, burning them, cutting off their genitals, etc., etc. And it would be groups of hundreds to sometimes thousands of people standing around watching, celebrating, looking at that. So just how ingrained that was really, really, it really hit. It really, really hit. And then on the conference side of things, really good conference, had some really dope keynote speakers and plenaries. We had Dr. Matthew Desmond, who wrote Poverty by America and who wrote Evicted. I got a signed copy of Evicted, which was dope. Nicole Hannah-Jones, who wrote the 1619 Project. And then Anthony Ray Hinton, who was I think he's the one that started the Equal Justice Initiative. And he was someone that was wrongly incarcerated and was on death row for 30 years. And just him talking about his experience and what that meant to him. One of the things that really stood out to me was that after that 30-year period, he still wakes up at 2:45 a.m. because that's the time they used to wake up the prisoners on death row to eat breakfast. And he still wakes up at that time every single day to this day. And he's talking about when he just got out of prison and his friend took him in to sleep on a bed. As he was sleeping on the bed, he started to get like a mini heart attack because his body just wasn't used to a soft bed, a big room, all these types of things. So he actually went into the bathroom and kind of sat down and lie down in fetal position, and that kind of calmed him down. And he did that for like a week when he just got out of prison. And that was just really, really, really deep to hear about. So learned a lot. I feel like I still have a lot of reflecting and have notes on notes on notes. But very, very rewarding experience. Tough in many ways, but also just appreciative to be able to be in that space and to, I guess, celebrate the many enslaved people that didn't have an opportunity to live the best life that they should have been able to live. That was kind of long,
Wow.
but yeah. Yeah.
Definitely I can see why you're exhausted. I think mentally I would be exhausted just from all of it brings up a lot. Like, it's not just something that you can go through and kind of let like roll off your back. It, especially as Black people, it gets inside of your psyche and it's just there for a while. So
Right. And I think like the fact that they were talking about everything from Black people being brought across here or stolen and brought across here to all the way to like mass incarceration and how that is the new form of slavery, as well as just some horrific things that have been happening in some of Alabama prisons, specifically St. Clair, where prisoners were literally just like killing each other and the guards would like let them have free reign on doing that kind of stuff. Just really some disheartening stuff. And one of the things that was really eye-opening as part of the Legacy Museum, and I spent almost like 3.5 hours in there. Definitely could have spent a lot more time. Was that you at the end you got to like have phone calls with people that were wrongfully incarcerated and just hear them talk about their experiences, and like many of them just being teenagers and going into prison, and then yeah, it's like lots of tears to say the least.
yeah.
How are you doing? What's up with you?
How am I doing? So I'm tired, but tired for a different reason. This past week, I had the Bloomberg American Health Initiative Summit 2023, which is, if you're unfamiliar with the Bloomberg American Health Initiative, it essentially is a program in which Bloomberg has funded a lot of different organizations and different schools to address the areas of focus in addiction and overdose, adolescent health, environmental challenges, food systems for health, and violence. And so the summit brings together different public health professionals across the country to discuss how they're progressing and how they're addressing different areas within these focus areas. So it is 2 days, kind of 3 days, because I'm a fellow. So I was there for some of the behind the scenes things and just a lot of networking, but great networking in the sense that I get to be around my colleagues. I get to meet people and reconnect with people that I met last year. This year, we got to take another one of our photos with all the Black DRPH girls. There hasn't been a male yet. So, Amari, if you decide that you want to do it, I'm just saying, we need you to represent for the men out there.
It's real.
But yeah, it was such a good experience. This year it was in Baltimore, so pretty local for me, but I did spend the entire 3 days in Baltimore, so it felt like I had like a little mini vacation. But it was good. It just is tiring because I'm an introvert, and having to be around people for that long and talking about really challenging situations within the different focus areas. It's a lot. But I'm back and now I'm dealing with schoolwork and all those things. So catching up on sleep while doing schoolwork. So that's how I am.
Yeah, that sounds very, very rewarding. I can imagine. I feel like COVID has made it hard for all of us to be in big spaces and interact with people. Because I also feel decently drained after those kind of days, and I don't consider myself an introvert. Neither do I really consider myself an extrovert. I feel like I'm an ambivert. I think that's the word.
Mm-hmm.
But yeah, completely understandable. And like to your point of DRPHs and not being many Black men DRPHs. Me and some friends started Brothers in Public Health, which many of you have probably seen somewhere or will see more online and stuff. And just goes to show that I think the statistic is 3.17%. There are only 3.17% of Black men who have Masters of Public Health degrees. So I can imagine the number for DRPHs is even lower than that. So there's a lot of work to be done, and I think representation, because when we think about health inequities, many times both Black women and Black men face disproportionate disparities or health inequities for various different things, and like talking about mass incarceration and just what that means, and needing more people that look like us in spaces to advocate for those kinds of changes. So yeah, I'm glad that we're both on like inspiring paths, I guess.
Yeah, it was a good week.
All right. Well, good luck with your homework.
Thanks, I need it.
You got this. In other news, I was actually in travel and I saw this article where the infant mortality rate rose for the first time in 2 decades, which was crazy. So like, what is it? Infant mortality is a measure of how many babies die before they reach their first birthday. Despite spending around 20% of GDP on healthcare in the US has horrible infant mortality rates, as we will get into. The national rate rose to 5.6 infant deaths per 1,000 live births in 2022, up from 5.44 the year before. While an increase from 5.44 to 5.6 infant deaths doesn't seem like much, this has been the first statistically significant jump in infant mortality rates in 20 years, so since 2001 and 2002. According to the latest OECD data, the US ranked 12th for the highest infant mortality rate compared to other OECD countries, and the average was around 4.1. The US had a rate of 5.4 compared to the lowest, which was Japan at 1.7, and Norway was near there with 1.9. So some of the reasons that there are high infant deaths are inadequate prenatal care, high rates of C-sections, and poverty, which contributes to chronic illnesses like obesity, diabetes, and heart disease. The top 5 leading causes of deaths for infants are low birth weight, congenital malformations, sudden infant death syndrome or SIDS, accidents, and maternal complications. While the overall rate has risen in the US, let's get into the health equity or health inequities of this statistic. So I'm looking at non-Hispanic Blacks, and I'm probably just going to say Blacks from now on and not non-Hispanic Blacks, but I'll say it for this one. Non-Hispanic Blacks or African Americans have 2.4 times the infant mortality rate as non-Hispanic whites. Black American infants are almost 4 times as likely to die from complications related to low birth weight as compared to white infants. Black American infants had 2.9 times the sudden infant death syndrome mortality rate as whites in 2020. In 2020, Black mothers were twice as likely to receive late or no prenatal care as compared to white mothers. And when we look at infant mortality rate by race, the Black population in the US has a rate of 10.4 deaths versus the white population having 4.4 deaths per 1,000 live births. When we look at low birth weight deaths, Blacks had a rate of 214 versus 56 for whites. When we look at the percent of mothers who received late or no prenatal care, 9.1% of Black mothers had late or no prenatal care compared to 4.5% of white mothers. When we look at the percentage of mothers who smoked during pregnancy, which was interesting to me, is that the Black population only had 4.5% of the population who smoked versus the white population at 8.1%. And this is really interesting considering that even though white mothers are more likely to smoke during pregnancy, the inequities or disparities that we see are still alarming for the Black population. what I think is really interesting and what we have to keep our tabs on is to see if this rise in infant mortality deaths was a blip or if it's going to be an upward trend that continues on. And one thing that I also thought was interesting is if we look at Black infant mortality rates, which are atrocious, if Black Americans were their own country, they would be ranked for the 8th highest infant mortality rate out of all OECD countries, and the US is actually ranked 12th. This is probably because the amount of infant mortality deaths that happen for Blacks in America. Addressing infant mortality requires a comprehensive approach, strengthening the healthcare system, improving access to quality prenatal and postnatal care, and tackling systemic inequities are key components. Additionally, community-based programs, education, policy changes can all make significant impacts. And I think this is also where we have to talk about having community health workers and midwives and doulas as part of that care team and really understanding that our system is not working. Infant mortality is a critical issue that demands our collective action. By understanding the complexities of the issues, we have to find out how we can address root causes and really get to not having such a high amount of infant mortality deaths for the richest country in the world.
This is ridiculous. I saw this too, and I read it, and I thought, I'm surprised, and I guess that's ridiculous that I'm surprised that it's the first time that it's gone up, because I've been looking at the statistics for Black infant mortality, and it has just gotten worse. So I think it's interesting that it's taken this long for it to impact the overall rate. But yeah, this is it's just sad.
It truly is sad, and I think I didn't get to look into this, and I'm not too sure if the data is out there. I'd imagine that it is looking at that trend for the Black infant mortality rate to see like what that looks like. And I know another thing that the article that I read alluded to was just kind of understanding that some states are really leading the charge on why this rate is increasing at such a high rate. And we really need to think about how we're looking at these issues and really trying to address them. I think root causes, policy-wise, and once again, it's like, how do we spend 20% of our GDP as a country on healthcare and still have such horrible outcomes? It's mind-blowing, and in 2023, going into 2024, that needs to change.
Yes, but I think, speaking of the states, I think that has something to do. I was reading another article that was talking about how Medicaid coverage has been decreasing over the past years. And since the pandemic, essentially, it's been rolled back amongst a lot of kids. And those kids are still eligible for Medicaid, but essentially no one is fact checking, and like paperwork is just being delayed and things like that. And so when we know that a lot of babies and kids and mothers really benefit from Medicaid coverage, it's just frustrating that some states can do what they want. And then, we're also living in a post-Roe world now, so who knows? But this is important, and thank you for bringing it to the table.
Yeah, very important. If we're not thinking about the people that are most vulnerable, the babies out there, then what are we doing as a society? And I think it goes to show why we need to consider universal health care and not employer-based health care to really ensure that everyone is able to access similar or the same or the right size fit type of care for themselves, so that we are not having these increases. But as I said, we'll keep our pulse on the rate going forward to see if this was just a blip and it goes down, or if this is the beginning of a horrific trend. On another note, promo break. If you are looking to stay connected with the Public Health Millennial, join my email blast. I will admit it has been a while since I've sent out an email, but that's because I'm trying to create some really good content and I haven't gotten the time to do that. And I guess also just letting you all know that I will not be putting out any podcast in December. I will be taking some time to rest to recuperate going into the year. So the only episodes that you all will get in December are a Health Equity Monday episode. So look out for that, and wish me well rest. But join the email list. You'll get more information and other things there.
We love a break. I will say that hopefully by the time you all listen to this, I will have sent out my newsletter, Becoming Dr. Health Equity Jazz. I've been on a break because school and life have been schooling and lifing. So I will be back talking all about the Bloomberg Summit, sharing some photos from that, and letting you all know that I am reinvigorated and energized about public health again. So check that out, and link is always in the bio or in the information.
Yeah, and I think it's important that we are highlighting taking breaks, especially as public health professionals, especially as Black people. I feel like the US and the capitalistic system that it is, it like really forces you to like just keep on grinding, keep on putting out stuff. But like, is that a self-sustaining way? Is that the way that we need to approach this work? And I don't think so. So I'll be taking that break, and I'm glad that you're also able to take a break, and we'll move forward coming into the new year, or coming back refreshed and ready to give you all great content, great ideas, and building community.
Yes, I'm all about taking a break. And since we're talking about breaks and wellness and all the things, y'all, the global wellness industry is now worth $5.6 trillion. Trillion with the T. I can't fathom that amount of money, but yeah, that's how much it's worth now. So the Global Wellness Institute defines the wellness industry as, quote, the active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. So you can imagine a lot of things fall within that. They have 11 categories or 11 industries that enable consumers to incorporate wellness activities and lifestyles into their daily lives. These industries include personal care and beauty, physical activity, healthy eating, nutrition and weight loss, and public health prevention and personalized medicine.
Wow,
so
I didn't expect that to be there. That's awesome to see.
I know, right? I was like, ooh, we're here. So the wellness industry has grown from about $3.4 trillion in 2013 and is expected to grow an additional 57% to $8.5 trillion in 2027. For context, that would make it about twice the size of the GDP of Germany.
Wow.
Yeah. So, in fact, it is expected that the global wellness industry will grow at 8.6% annually, which is higher than the projected global GDP, which is anticipated to grow at 5.1%. So, wellness is doing very well. So, why does this matter? So, one of the biggest changes since prior to the pandemic is the spending on public health, prevention, and personalized medicine. Spending in this category increased from $358 billion in 2019 to $611 billion in 2022. This metric includes health screenings for COVID-19 and cancers. It is expected that this category will grow at 1.6% annually over the next 5 years. So when we look at the spending per capita of the overall wellness in North America, it's at $5,108 per year compared to Europe, which is only at $1,596. So when we think about wellness, I can't talk about it without expressing the disparities and racial inequity and what some people have considered the whitewashing of the wellness industry, especially in the United States. So when we think about wellness in the United States, it typically has become synonymous with wealth and access that's granted only to those who are fortunate enough to be able to afford the expenditures of wellness. And while the data around utilization and makeup of the wellness industry is sparse, results from the National Health Interview Survey in 2002, 2007, and 2012 showed a widening gap in people who seek complementary and integrative health services, which are going to be like your massage therapy, acupuncture, etc. Over these years, non-Hispanic whites have increased usage while Hispanic adults and non-Hispanic Black adults have decreased usage. So wellness is costing us more. It's a growing industry, but yet it is prone to the same racial inequities and disparities as our healthcare system.
Yeah, it's like who has access to stuff. And I think about it a lot in like when you look at yoga studios around, granted, like, and there's a lot of whitewashing in yoga, and that's like not the conversation that I'm going to have today, but just like understanding that it's very inaccessible to people, the cost of those types of things. And I think it's important for us to think about how does this create or just solidify more disparities in health and in access to these types of ways, because if we're spending this much, especially in the US, but still seeing very poor health outcomes, why is that so? Is that because only certain groups of people have access to this? What are the barriers there? What are the other things that we aren't thinking about that are not getting to the people that need wellness the most?
There's definitely a tie between the wellness industry and our healthcare industry. And when we think about it, if we're having this whitewash system, essentially we're only bettering the health of those who already are healthy or who already have the ability to use their healthcare and to tap into the healthcare industry in the same ways. So we're not really doing what we should be doing, which you would think improve the wellness industry for those who are Black, Hispanic, Native American, Indigenous, who need wellness. And I say need, like a very real need this in order to potentially improve their health. But it's a $1 trillion industry that does not seem to want to give into nonprofits and things like that. So
yeah, and I think it takes me back to reading Poverty by America by Dr. Matthew Desmond, and just firstly thinking about why, or just how people who are in impoverished situations, let's take, for example, someone that's working at McDonald's perhaps, or another fast food restaurant who doesn't have any health care, who has to work possibly 2 jobs, and then doesn't have access or time or the resources to take care of themselves and have these wellness types of things, while other people are in different types of jobs where they might have a gym in their building, or they might get paid, or they might get reimbursed for gym expenditure and different things like this. And as you said, it like just creates more of the disparities. And one of the other things he really talks about in the book is like the destruction of the unions in the country, and just how that has led to more poverty and less voice and advocacy for people that are in more impoverished situations. And I think about like, what if all organizations, or like a lot of organizations, had unions, and in those unions they were saying that wellness is important, we're going to put this certain amount of dollars aside so that people are able to take care of themselves and really rejuvenate and have and live the healthiest life that they can.
That brings up one of the interesting parts of this study. They found that the workplace wellness has actually decreased. So I think in the US, we've been talking a lot about the workplace wellness initiatives and, you know, how, are they actually working, and does this actually have an impact on the happiness and well-being of employees? But this study found that they are decreasing in terms of the overall makeup of the wellness industry. So I don't know if that has anything to do with just the kind of the backlash that some employers have been getting of, you know, saying like, oh, we're going to give you wellness initiatives, but we're not going to increase your overall salary. We're not going to address the toxicity of the workplace. And we are still expecting you to work until burnout. but there are a lot of things that need to be addressed within the wellness realm, because it does have a lot of impact in overall health and well-being. And when we're looking at where we spend most of our day, most of our time, it's at work.
Yep. So it's really thinking how can we use that workplace and to really drive forward health in many, many different ways.
Yep. So, since we're talking about wellness, it's time for our equity in action.
Dun dun dun.
If this is your first time listening, which I hope it's not, Equity in Action is our health equity quiz where Omari and I try and stump each other using a true or false statement. And we are nearing the end of the year where we're supposed to figure out what the consequences for not winning or something.
Consequences or benefits. We haven't figured that out, but I guess we'll figure it out within the next month or so.
And we're going to have to go back and figure out where we are because I don't remember.
Neither do I.
Okay, so Omari, are you ready?
Always ready for some friendly competition.
Okay. I'm going to give you an option. This is
about
wellness.
Option A.
Option A?
Yeah,
okay.
Option A.
Okay. All right, fine. Okay. True or false? The percentage of Black chiropractors in the United States is less than 1%.
True.
False. 2.8%.
2.8%. Okay.
Yeah.
I rushed that one. I should have given some logical some logical thinking out there, but I did not.
So yeah, 2.8% for chiropractors, 6.8% for physical therapists, assistants, and aides, 8.8% for massage therapists, and then some other things. But yeah, since we're talking about wellness, it felt right on task.
Yeah, definitely interesting. I definitely should have thought through before I responded to that one because I would have like deduced that it probably is higher than that. But hey, here we are. I gave you that point.
So now we have to figure out who's winning as we go into our very last one next month.
Yep, we definitely will. We'll see how it is. And I guess we could also be tying because it is 12 months. Yes, we could. So we will figure that out and we will let you all know. All right, y'all. Thank you all so much for tuning in today. If you have not subscribed as yet, be sure to subscribe, share it with a friend, ask that Equity in Action quiz question to someone else. Maybe let them deduce the answer and not just like go top of mind, true or false. So here we are.
It's okay. You're fine.
I am absolutely fine. That's for sure. But yeah, nice chatting with y'all, and I hope that you all have a great December. We will be back with y'all at the end of the year.
Yes, and safe travels and all of the holiday events that people are going to. I hope you have lots of fun. If you're doing Friendsgivings and all of those things, have happy holidays.
Yeah, and be sure to get boosted if you have not as yet. Stay away from people if you're feeling sick. Wear a mask. All the other things.
Yes, please do. All right, y'all.
Be well, everyone.
Peace.
Peace.